Greetings, dear colleagues of the VA Caribbean Healthcare System. This is your director, Carlos Escobar, with an energizing message of hope. I have the pleasure to share with you that on June 6, 2019, the Department of Veterans Affairs will benefit with the provisions of a new law known as the VA Mission Act of 2019. The vision of the executive in charge for the Veterans Health Administration is to convert our organization into an integrated, high-reliability organization. I invite you to learn in detail the summary that follows. The Mission Act streamlines and improves community care, expands caregivers' eligibility, and strengthens VA workforce and infrastructure. This is the largest change in access to care that our veterans will experience in recent history. It brings the flexibility and puts the veteran in control of how they access our services. The following presentation is a summary of 5 training modules that are essential to understanding these upcoming changes. Let's see.
VA is one integrated system with internal and community aspects of care delivery. The Mission Act strengthens both of these aspects by giving us new opportunities to care for veterans. With new workforce recruitment and retention tools, anywhere to anywhere telehealth across state lines, new ability to innovate and stay at the leading edge of healthcare and unified, integrated community care experience for veterans that is also simpler for employees. Executive in charge, Dr. Stone's vision is to transform VHA into an integrated, high-reliability organization using 10 lanes of effort. VA Mission Act is one of the 10 lanes that will enable Dr. Stone's vision. That vision is a unifying factor for all employees and all initiatives' mission addresses in network and non-VA healthcare issues, veterans' homes, access to walk-in VA care, prescription drug procedures, and more. To deliver on the opportunities in the Mission Act, VA is ensuring every element of this new work is ready for launch. This includes providing thorough and easily accessible training for employees, providing education for veterans on new benefits and programs, and ensuring that all of the business elements, regulations, processes, and policies, contracting, technology are in order. Notably, the key technology that will enable Mission Act implementation was designed and vetted by frontline clinicians. VHA and our IT partners are working in lockstep to ensure that new products not only deliver better care for veterans, but are also designed to make things easier for employees, saving time and energy and enabling care teams to focus on veterans. VA is improving internal and community care coordination through one optimized customer service network. Improve systems that work together to transform our business processes and deliver better customer service. Transparent healthcare options to help veterans make informed healthcare choices. Through the Mission Act, VA gives veterans the power to choose the care they trust, and more veterans are choosing VA for their healthcare than ever before. Patients' trust in VA has skyrocketed, currently at 87.7%. VA is leading the healthcare industry in transparency by helping veterans compare data across VA and the private sector so they can make informed decisions when selecting a provider. VA is giving veterans more choices in their healthcare decisions and improving transparency by becoming the first hospital system in the nation to publicly post wait times, opioid prescription rates, accountability, settlements, and chief executive travel. Our medical services will continue to evolve to meet veterans' needs and strengthen the trust in the VA by constantly innovating, upgrading, and pursuing better ways to serve our nation's heroes. The Mission Act gives VA more power to recruit and retain medical talent by increasing its education debt reduction program and providing more flexibility for recruitment, relocation, and retention bonuses. To attract top talent, VA is increasing the maximum amount of VA's education debt reduction program from $120,000 to $200,000 for a 5-year period, not exceeding $40,000 per year. The program may now also be used as a recruitment and retention tool for vet center mental health positions. Expanding graduate medical education into medically underserved areas, as well as implementing Veterans Healing Veterans, a pilot scholarship program for 18 veterans enrolled in certain medical schools, ensuring podiatrists employed by the VHA are paid from the same pay systems as VHA physicians and dentists. The Mission Act allows VA providers to use telehealth to deliver care across state lines and into veterans' homes, regardless of whether or not the provider or the patient are on federal property. VA is recognized as a world leader in the development and use of telehealth. Telehealth helps VA move care outside of VA facilities and into veterans' homes via their computers and mobile devices. VA's goal is to have all primary care and mental health clinicians telehealth capable by the end of fiscal year 2020. Access to care for veterans is anticipated to increase with the growth of telehealth. The Mission Act guides VA to implement a pilot program to establish mobile deployment teams to address and improve care in underserved areas. Underserved facilities are defined as a medical center, ambulatory care facility, or community-based outpatient clinic in the Department of Veterans Affairs with a shortage of healthcare services. The Mission Act allows VA to expand or create education programs in certain underserved areas. The Graduate Medical Education and Residency will allow VA to support residents' costs at covered VA and non-VA facilities. The Mission Act puts VA at the center of care to ensure veterans receive the best care possible, whether in a VA facility or through a community provider. One of the key goals of the Mission Act is to ensure veterans have access to health care where and when they need it. VA has been delivering care through community providers for decades. The Mission Act will improve community care, making it easier to navigate for veterans and their families, community providers, and VA employees. Veterans who access community care can expect streamlined eligibility criteria, a new urgent care benefit, and improved customer service. Community providers can expect their interaction with the VA to be easier with new IT systems and timely payment processing. The Community Care Decision Support Tool will make it easier for staff to determine patient eligibility for community care and help VA providers to decide in real time whether to refer a veteran to VA care or community care. Automated wait time and drive time calculations. At a glance, eligibility determinations, reporting capabilities integrated into existing consult order workflow and support best medical interest discussion between provider and veteran. Eligibility criteria and final standards were based on VA's analysis of best practices both in government and in private sector and tailored to the needs of our veteran patients. The criteria include: veterans must receive approval from VA prior to obtaining care from a community provider in most circumstances. Veterans must either be enrolled in VA healthcare or be eligible for VA care without needing to be enrolled to be eligible for community care. Eligibility for community care will continue to be dependent upon a veteran's individual healthcare needs or circumstances. VA staff members generally make all eligibility determinations. Veterans will usually have the option to receive care at a VA medical facility regardless of their eligibility for community care. Meeting any of the 6 eligibility criteria is sufficient to be referred to a community provider. A veteran does not have to meet all 6 of them to be eligible. Veteran needs a service not available at a VA medical facility. In this situation, a veteran needs a specific type of care or service that VA does not provide in-house at any of its medical facilities. When a veteran lives in a U.S. state or territory without a full-service VA medical facility, in this scenario, a veteran lives in a U.S. state or territory that does not have a full-service VA medical facility. When a veteran qualifies under the grandfather provision related to distance eligibility for Veterans Choice Program, when VA cannot furnish care within certain designated access standards, when it is in the veteran's best medical interest, when a VA service line does not meet certain quality standards. The Mission Act will expand eligibility for VA's program of comprehensive assistance for family caregivers under the Caregiver Support Program, which is currently only available to eligible veterans who were injured on or after September 11, 2001. The expansion will open the program to eligible veterans from all eras of service and their caregivers. Veterans in these programs need assistance for activities of daily living such as bathing, dressing, grooming, mobility, eating independently, and use of prosthetics. Program participation is also available to qualified veterans in need of supervision or protection for mental health and cognitive issues. The Mission Act places peer specialists in VA patient-aligned care teams in at least 15 VA medical centers by May 31st, 2019, in at least 30 VA medical centers by May 31st, 2020, to provide services for mental health, substance use disorder, and behavioral health in a primary care setting. Peer specialists have a variety of roles in their work with veterans. They help veterans with treatment goals and often go with veterans to mental health or primary care appointments. Veterans may request to work with a peer specialist, or the treatment team may ask a veteran if he or she would be willing to meet with a peer. Each site will also have female peer specialists available when requested or needed by female veterans. This is the first of many steps that we are going to take to improve access for our veterans. We are in the path of becoming a high reliability organization, providing the best care anytime, anywhere. To clarify any information and for future updates, please contact the VA Mission Act champion at your facility or visit VA Insider at vaw.insider.va.gov.
I am confident that you found this information relevant. I challenge you to unite our efforts to provide the service of excellence that we are accustomed to. Thank you.